What would you recommend for hollow eyes? Hi, would anyone be able to recommend the best procedure to have to help with hollow eyes? I am 25 years old and have dark, deep hollows. My right side is the worst. Thanks.
Thank you for your question. You're 25 years old, you submitted 2 photos, and you're concerned about how to deal with under-eye hollowing. So we can certainly explore a couple of different options and to also understand the method and the basis for those options. So at 25, of course, you're still young, and therefore we're not going to attribute this to aging, but rather it is genetics. You have light skin, thin, and the area that is under your eyes is relatively hollow, particularly in some distinct areas that we refer to as the tear trough, as well as the eyelid to cheek junction, and sometimes we also refer to as the V-deformity at the junction where the bone of this eye socket meets the cheek. So in our practice, as a cosmetic oculofacial plastic surgeon, we deal a lot with this issue, and we always want to have essentially procedures which are predictable, consistent, and of course allows for quick recovery. So with that in mind, we do a combination approach, and we'll start first with the term hollowing. Hollowing essentially you can state means volume loss, right? So when you look at this area, you want to restore this area with some kind of volume. In our practice, we restore volume with a hyaluronic acid filler, such as Restylane. Now, it is still an area where the skin is very, very thin. So this is in contrast when we use Restylane to enhance lips or to enhance the nasolabial fold or other areas where the skin is thicker. The eyelid skin in this area is very, very thin. And if you do research, you'll see that a lot of people are concerned about lumps and irregularities. And so it is technically a little bit challenging to do a really, really nice job. So ideally, it's someone who does it for you should have a lot of experience in this area. So hyaluronic acid can be a very effective filler in this area. Now, of course, when you start doing something like a filler, there is some maintenance involved. Some people, they need to come every 3 months, other people 4 to 6, some people every year. So there is a lot of variability with individual, in the way an individual metabolizes the hyaluronic acid. Now, on top of that, we have found a great synergistic benefit, and that is with the material called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and what is involved is like a typical blood draw that you'd have from a doctor's office or a lab. That blood is drawn and put in a tube and spun. And what we're doing is we're concentrating the growth factors that are responsible for wound healing. We have seen a great combination or synergistic effect of combining hyaluronic acid with platelet-rich plasma. It results in a combination of volume improvement and skin quality improvement. When you think of hollowing, you also think of shadows and darkness, and if you look at the skin quality, some fine lines and wrinkles. So when you combine the two, in our hands, we've seen this to be a really nice combination. There have been studies done where this combination was used for wound healing, and it was very successful. So clearly there is some type of benefit in the combination of PRP and hyaluronic acid as opposed to each one being used individually. So that would be our approach to someone like yourself in our practice. We follow our patients very closely, so we want to make sure that there are no irregularities, and if there is needed any enhancements or touch-ups, we do that as well, just to make sure that the contour is as desired and looks natural. So my advice is to you is to look for physicians or cosmetic surgeons who work in this area a lot, and don't always follow the hype of the toys or the material. Sometimes doctors promote little instruments like blunt cannulas and things like that. I don't mean to put those down, but basically it's really more about technique than it is about a particular instrument. It's the hands of the doctor, the hands of the surgeon that make the difference, and how it's applied and the time. It's very meticulous, it's a very sensitive area. It has to be done with great care and artistry. So meet with some doctors and find someone you're comfortable with and give that a try. And what's really nice about this option is hyaluronic acid can be dissolved, so if you don't like it, you can use something called hyaluronidase to get rid of it. But hopefully you'll avoid that as an issue. So I hope that was helpful. I wish you the best of luck, and thank you for your question.